Heart attacks. A heart attack, or MI, which stands for myocardial infarction, is a serious medical emergency in which the supply of blood to the heart is suddenly stopped, and it's usually caused by a blood clot. Now, people often think a heart attack and a cardiac arrest are the same thing, but they're not. If someone's having a heart attack, they're conscious, whereas if someone's in cardiac arrest, it means they're unconscious because the heart is completely stopped. A heart attack is a medical emergency because a lack of blood to the heart may seriously damage the heart muscle, and it can obviously be life-threatening. Symptoms of a heart attack can vary, but they can include pain, normally in the centre of the chest. It can feel like it's being pressed or squeezed by a heavy object, and pain can radiate from the chest to the jaw, to the neck, to the arms and the back. They may also experience shortness of breath. They may feel weakness on one side of the body. They might feel a great sense of overwhelmment or anxiety. They might be sick or feel sick. They might go very pale in colour. They just generally look unwell. Now, it's important to note that not everyone experiences this severe chest pain. The pain can often be mild and mistaken sometimes for indigestion. It's a combination of symptoms that's important in determining whether a person is having a heart attack and not the severity of actually the chest pain. Now, a heart attack is a medical emergency, and as soon as you suspect somebody's having a heart attack, we must call 999.
Now, while we wait for the ambulance, we don't really want to leave the casualty on a sofa,
because if they suddenly do stop breathing and we need to perform CPR to them, then you now need to lift them from a sofa to the floor, which can be quite difficult. So get them onto the floor while they're conscious and they can help you.
and we're going to sit them in the W position, which means with their knees slightly bent. Now, they might be able to do this unaided, or you might be able to put cushions underneath their knees to be able to support them. You might also want to loosen any tight clothing that's around their neck and just stay with them and reassure them. If you have helpers around, you might also want to discreetly go and tell them to get you a defibrillator, an AED, an automated external defibrillator, just in case this casualty does go into cardiac arrest and you need to be able to perform CPR to them. Now, I'll leave the links for the CPR videos in the description below, just to refresh your memory of how to do CPR if someone does stop breathing as well. And the link will also have how to use that defibrillator for you. Now, while they're sitting in the W position, you might also want to give them their medication. Sometimes with a known history of a heart issue or heart problem, then they might have a spray, a GTN spray, they will spray underneath their tongue. Or they might have aspirin in the house. And chewing 4 tablets or 300 milligrams of aspirin actually helps thin the blood. Just be very careful they're not allergic to aspirin before you encourage them to take it. And of course, if they do go into cardiac arrest, we need to lay them flat on the floor and begin CPR.
Now, you might be thinking, why does somebody actually have a heart attack? Well, coronary heart disease, CHD, is a leading cause of heart attacks. So CHD is a condition where the major blood vessels that supply the heart get just clogged up with deposits of cholesterol, known as plaque, causing a blood clot to develop. The clot may block the supply of blood to the heart, triggering a heart attack. Guys, please don't forget to subscribe to our channel. Thank you for listening. Don't forget to hit that subscribe button and then the notification bell so you don't miss out on any of our other videos.